Rhinoplasty happens to be in the top 5 plastic surgical procedures for both men and women. You have to really tailor the surgery to the patient's desires and needs, which is why, by the way, morphing photography is a communication tool that should be used on all rhinoplasty patients. It allows the surgeon and the patient to sit down and morph the patient's face in a way, or specifically the patient's nose, in a way that's going to make the patient happy and also assure that the surgeon can really deliver that type of result. But when it comes to the difference between a man and a woman, in general, we have aesthetics that we tend to fall back on so that we don't create issues. And the real issue is feminization of a man. Unless that's our goal, for most of the time it isn't. Most men who get rhinoplasties aren't in the process of feminizing themselves. They just want a better looking nose. And some of those goals typically revolve around nasal projection, that is how far away the nose projects from the face, the bump up here, and maybe getting it flat, and of course the tip and where it sits in terms of its rotation, high or low. And so in general, with a man, we don't want to scoop out the bump. We don't want to deproject the nose. It's going to give him a look that isn't really strong and masculine. Similarly, we don't want to bring the tip up too much. These are the things that tend to feminize the face, and we, in general, do that more often with a woman. Get the bump flatter, deproject the nose if it needs to be deprojected, and rotate the tip if it needs to be rotated. But in general, we tend to see a tip that's a little higher, a little less projected, and a bump that's a little flatter. In men, we tend to keep the nose as straight as possible, but we don't want to scoop that nose out. We want to maintain projection unless it's truly overprojected. And in general, we don't want to rotate the tip too high. And when we do that, we get a nose that is good looking, strong, and masculine.